Welcome to Patient Matters, where we dive deep into the world of plastic surgery. I'm your host, Dr. James Southwell Keeley. In this series, we will engage in candid conversations with patients, specialist doctors, nurses, and others who have shaped this journey. Together, we will explore the realities of plastic surgery, covering everything from safe practices and patient recovery stories to the latest techniques and the artistry behind the craft. We'll also discuss governing bodies, address botched and revision surgeries, as well as share simulated consultations, all aimed at guiding you through your own plastic surgery journey. With decades of experience, I'm proud to be a member of ASPS and the Royal Australasian College of Surgeons. I serve as a plastic surgeon at St Vincent's Hospital in Sydney. Join us as we unravel the complexities and beauty of plastic surgery, one episode at a time. Hello and welcome to my podcast. I'm Dr. James Southwell Keeley, and this is Patient Matters. So we'll be talking about the thing that gets me out of bed in the morning, the thing that I'm most passionate about, and that's plastic surgery. We'll cover some patient experiences and some of the things that I've learned along my 20 odd years of performing plastic surgery. Now we'll be welcoming Melanie shortly. She's a working mother of two, and we're going to have a great chat about things that interest her and interest me. Today we're talking about choosing your right plastic surgeon, and fundamentally that is probably the most important decision you will make when you're going out to undergo a plastic surgery procedure. So finding the right plastic surgeon involves multiple steps, but we'll delve into that together with Melanie. So let me introduce Mel right now. Here she is.
Hi there, good to meet you, Dr. James.
Lovely to meet you, Mel.
Yeah, good to be here this morning, and
Excellent.
I hope to learn a little bit and sort of form a bit of a better opinion about sort of what I'm moving towards.
You're moving towards?
Well, what I'd like to achieve, actually, yeah.
Now, Mel, have you ever had any plastic surgery procedures yourself?
No, so there's quite a lot that I'd sort of like to cover as well. So I feel like this would be a really good start to make an informed choice, I suppose, would be the right.
Absolutely.
Right
And what
phrase.
about friends? Do you know anyone who has had plastic surgery?
Yeah, look, I've got a few in my mother's group that I sort of, I've asked a few people, and, it's quite a big decision. So
It's a huge decision.
You can go online and do some research, and then you ask your friends, and then hopefully, you arrive at the right spot. So that's what I'm aiming for, yeah.
And then with the friends who have had the surgery, how have they made that decision? What's the final kind of clincher that's got them to see that particular person?
Look, I think probably the reviews on, of their surgeon, like when they've done the research, that's been a big part of it. So if they've had client recommendations, that's probably been the thing that's really driven them to make that final decision. So that's a big part of it, I guess. It is a big decision. So yeah, it's important, really important. So,
So they're fundamentally making that decision around what experiences that other friends or trusted people in their lives have made. Or perhaps they've made that decision based on advice they've sought online from anonymous people who've purportedly had the same sort of thing done or performed by that particular surgeon.
Look, I guess it's a combination of the two, because, your friends' expectations may be entirely different to yours. That's why you can't take it just from your friends or people you socialise with. There'll be different backgrounds, and you can take their experience away as well, and that will give you like a rounded, opinion as well. So that's what you want to do. It's such, like for me, it's something that you don't do very often. So when you do it, you want to do a really good job of it,
Totally.
So.
And do you think any of these friends who've had surgeries have looked into the training that the respective surgeons have had? Is that part of that kind of research process that they'd go through?
Look, I'd say, to be honest, there's been a bit of a mixed bag about how happy they've been, and I feel like some have been a little bit disappointed or not entirely done their research. So when you then go back and ask retrospectively, what do they think they could have done a little bit differently? Like, how did it meet their expectations? And was the surgeon on the same page with them? Were they too outrageous with their expectation? I've had two children, so I feel like what I would be hoping to achieve may be a little bit different than what potentially I could get. So I think it's the surgeon you two need to meet on the same page.
Totally.
I guess that's crucially important. Otherwise, you just neither will be happy.
Yeah.
So, yeah.
So I think you've really hit the nail on the head there for one of the fundamentals that I think is underpinning a really excellent and the patient relationship that's going to get you to where you want to get to, and will lead to that mutual respect and understanding, and that is that you really click, because not all plastic surgeons or not all surgeons are created equal. And so one of my sort of 3 or 4 point checklist that I'd recommend to patients is that you connect with people. Because when you're in the same room with the person who can execute what you're hoping to, then if you click with them, you're going to get through that journey just fine. But you've actually got to rewind the process a fair bit from there, I'd say. And whilst the reviews online are really helpful, interpersonal, like just one-on-one recommendations, I think are more profound, because those online reviews are often unvetted. Who's written them? Are they working in the surgeon's practice? Are they actually a true review? Whereas if you're talking to someone who's had a hands-on experience to say, yeah, that was great, they looked after me and I thought I had a really good experience, I think that is more profound. But even winding it back a step further, I think the most important thing is to know what sort of training your surgeons had, because not all training is equal. And like, if you've trained through the Royal Australasian College of Surgeons, then you're a true plastic surgeon. There's a lot of pretend surgeons out there, or surgeons who've had not true surgical training. So they've different avenues by which people can call themselves a cosmetic surgeon. And often it's just GP training.
That's frightening, isn't it?
Terrifying.
Absolutely.
Yeah.
I
but
mean,
with enough hype and enough social media, they seem to be able to rise above what you or I might expect a surgeon could be able to do.
Yeah, that's absolutely frightening. You think of the implications would be just horrifying.
So I think if you look at their letters behind their name, it's got to be somewhere on their website. They have to have the FRACS, that's a Fellow of the Royal Australian College of Surgeons. And then instantly you should be feeling, this person's legit. And you can look up their accreditation with APRA. That's the national accrediting body for all healthcare workers and other workers too, for that matter. But if you look them up and that says general practitioner, well, that's really what they are, irrespective of what their website might be telling you.
Yeah, that's a bit of a red flag.
It's a massive red flag. That's right. Now, are you a nose person or are you a breast person? So that's your next kind of tier of, right, do I want to see a generic person who might do 2 rhinoplasties a year, but I want them to do my rhinoplasty, or do I want to see someone who does 3 a week and does 150 a year?
And they specialise,
That's it. And a good plastic surgeon, a moral and an ethical one, will say to you, I can see where the problem lies. I agree your nose could be improved, or I can see what you're saying with your breast, the thing that makes you unhappy about them. But I'm not the person to do that. And here's 3 names of people who can help you, or I'll direct you towards my professional body, that's the Australian Society of Plastic Surgeons, and you ask through them, that's the ASPS, and they will provide you with a list of people who you could reach out to. So that way you know that they're properly trained, you're happy that they are going to do the right thing by you because they do a lot of these things, and you connect at a personal level, and you think, okay, that's great.
They've got a vested interest in your outcome, I guess. This is exactly what, we should both be on the same page. And
your vested interest in that person's outcome shouldn't be based upon the fact that you don't want to get a bad review online. It should be based upon the fact you actually care about that person. That's pretty hard to tease out in a consultation, but you kind of get that vibe. You often just get that vibe. You think, this person's real and they're going to care about me.
So you
understand what I'm saying.
With a consultation, do you think it needs maybe 1 or 2 consultations then? Or what would it be a minimum to sort of...
I think a minimum, and it's now mandated for a cosmetic procedure, is that you have 2. Yeah, so you have time to go away and think about it. You're like cooling off period, as it were. But...
and then come back with your questions on the second visit.
I often encourage patients to come back 3 times, 4 times. I don't care how many times you come. Once you've had your surgery, we're in the after phase. Like, we can't rewind that clock. but you come as many times as you want beforehand, because you tip over into a different relationship once you're post-surgical.
Yeah.
So come in with all the questions, bring a friend, bring a next of kin, revisit the questions again.
Yeah.
We'll look at some photos. I want you to be comfortable that we're
and
on the
really
same
clear.
page.
Yeah, absolutely.
That's it. And if people are kind of dithering a little, they're thinking, I'm not sure, I'll say, go and see one of my colleagues. Get a second opinion.
Okay.
Who knows? You might click better with them and they'll look after you. But I'll send you to someone I know can do what you're aiming to have done. Someone who's going to look after you, not some random person.
So it's almost like you're assessing each other in a way. If you can,
100%.
If you can match each other's needs in it, I guess that's the best way.
That's right.
Yeah, you'll meet in the middle, I guess.
Exactly right. Do they have the skills? Yes. Are they properly trained? Yes. Do I connect with them? Yes. Do I feel confident that they'll see me through good and bad? Because sometimes it's a bumpy ride, but I've got that. I know, and particularly profoundly, if that you know that from personal experience, having chatted to friends who've been through that process, I know I'll get to the other side with this person. They're going to stick with me. I won't be abandoned to the emergency department and swept up by, a plastic surgical team in some hospital because there's no after-hour care for me, or they just refuse to answer my calls, or I've become a frustrating patient for them and they just shut the door to you. You don't want any of that. You want to know that from start to finish you'll be there. Yeah. And actually you're going to be there for the rest of their days.
Yeah. Well, that's really comforting. I mean, you don't want to sort of be left in limbo and make this big decision and then your surgeon sort of loses interest, which I've done some research, and it seems like there can be a bit of that where maybe the money's been exchanged and the doctor loses interest, you know what I mean? And that would be quite frightening, because it is a big decision, and it's not one you want to do too many times, and the health risks, you want someone that's there from the start to the finish. So if
I can add an extra tier of a recommendation there, it is that ideally your surgeon is also affiliated with a public hospital.
Okay.
Because let's pretend you're on holiday somewhere, having had your surgery 6 weeks earlier, and you develop an infection, and you're in wherever, you're in Queensland, you're on the Gold Coast, you go to Gold Coast Hospital. Gold Coast Hospital will assess you, and then they'll contact me.
Yep.
And if I've got nowhere to bring you to, you're kind of
in limbo again.
You're in limbo. You'll be looked after, but I'm not overseeing your care. I'm a degree removed, or possibly several degrees removed.
Yeah.
But if I can say to the Gold Coast people, oh my gosh, come on, please bring her back to Sydney, bring her to this hospital, because I'll transfer you directly into that hospital, and I will pick that patient up at that point, and I will continue that care journey with them from that point onwards, then I think that's really what all patients should be able to expect.
There's just so many variables with it, isn't there? There's so many different sort of paths. Obviously, everybody wants it to go on a smooth path, but I guess you have to plan for things that you don't expect to a degree. Right. So you need someone there that can take charge at whatever turn that things sort of crop up. So
now, I was never a Boy Scout, but I'm going to borrow from the Boy Scouts. I'll probably misquote them.
Yeah.
But you've got to plan for the worst and then hope for the best.
I didn't want to say that because
you have to.
But I guess you have to, don't you? Because
every decision you make surgically, you need to know, I've got to get out of jail. I've got a little lifeboat. If this doesn't work, I can do that. Yeah. If that doesn't work, I can do that. And once it's all done, well, the healing process is underway, and it's a little bit out of the hands of the surgeon, but still stuff happens.
Yeah, I guess
because you holiday, you get a little belly button infection or a stitch pops or something. You've got to have a backup plan. What's the next thing you do? And you need to be contactable, or at least someone that is, within your operating sphere is contactable, and then they can inform you, and you can then pick up that patient at that point.
Yeah, because everybody's just so different, isn't it? Like different ages, different sort of skin types and things that you have to factor in. Yeah.
Which touches upon another really important thing with plastic surgery. It's not a one-size-fits-all. You really have to tailor every procedure to that individual, because everyone's a different height, a different weight. You've got different skin type, as you've alluded to. There's different elasticity in your tissues. You've got different healing capacity. The medical background, the medical problems that you bring to your consultation are unique to you, and it's a different combination of medical issues to the next patient. And so you can't just say, well, I'm going to do the same operation for both people, because it just won't work, or you're more likely to have problems. And you're setting yourself up for a bumpy ride or even failure. So you've really got to tailor every decision when you're dealing with a human body. It's a really complicated biological system, ultimately. And then layered upon that is all the emotion that we bring. You're not just a sort of a little experiment. Oh, that's a different experiment to that one. You're a human being, and you're a living organism, and you've got a personality, and you've got to go home to your family, and you integrate with society, and you have all of these crossovers that makes caring for a human really, really complicated. And you have to individualize that care if you really want to get the best outcome.
I think also with the things that are on television at the moment, I won't reference anything in particular, I feel like some of the people that are getting their faces fixed also is just, it is so unnatural. And I do think, what are they saying to the surgeon? Like, is it lost in translation here? Is this people just walking around wanting this really tight thing, and this so unnatural? And I don't know, I feel like there's no communication there. I'm looking at them thinking, what were either of them thinking?
Well, that's right. And sometimes I think it's surgeon driven, that's the look they do, and that's all they do, and that's all they can do. So that's what you get. And then sometimes it's patient driven. So I just want to look like my friend who's wanted to look like someone in some glossy mag in America.
Yeah, I feel like there's a bit of a look going on, isn't there?
And then once there's a bit of a headwind of that, people start to pursue that.
So can I ask you, do people come in and say, I would like to look like this person? Does that, is it a lot?
All the time.
Does it really? Wow, okay.
Yeah. And I
what do you
respectfully
say?
show them the door. I say, I can't do that for you. It doesn't work like that.
Yeah.
But maybe it does for some people in some parts of the city.
Where there's a real
the cookie cutter
trend.
model that they offer.
Yeah.
You're disrespecting and disregarding your individual features. So just having huge cheekbones or the appearance of huge cheekbones doesn't necessarily suit your face.
Yeah.
So you shouldn't be just saying, you shouldn't agree with that. You should be trying to educate and direct towards a more natural look.
So try and highlight the beautiful features.
Correct.
So find a balance, I guess.
Find a balance.
Yeah. And not sort of be suckered into the fads and the trends. Like, I mean, with the Brazilian bottom lift, I mean, that's another one. I don't know. I guess these trends come and go. So I guess your job is kind of to try and give a person what they want, but also something that's not going to date as well. Correct. You know what I mean? Or come in and out of fashion. So
yeah, absolutely.
Bit of a fine line, isn't it? That's a lot to do. I thought I had a lot to do as a client or a customer, but actually the surgeon's job is...
Well, we're both invested in the process. Yeah. And my personal take on things is natural's best. It's always best.
Yeah.
Natural beauty is ageless, essentially. And it doesn't matter if you've got a few wrinkles. It doesn't matter if it's not, picture perfect. But what's picture perfect?
Yeah.
There's so much editing that goes on in all of those photos, in all of the magazines, and the people who are on the screen, they do hours of makeup a day and have the surgery. Yeah. But that's not really how normal people look.
I think there's a fine line, isn't it? It's almost like you look sort of old but frightened of aging, and I feel like that's you can still age gracefully and be sort of tweaked or finessed, but you need someone that's sort of shares that vision too, I guess. Yeah. And I guess that's the search, isn't it, to find that same person. Yeah. And I mean, unless you're into it, and of course that's fine as well. But for me, I find that quite frightening, just that really, really overdone, So, you need to find that beautiful feature and really finesse it, I guess.
Finesse it. So I think, as a really good example there, I've recently seen a 70-year-old lady who had a facelift when she was 50. So she would have been pretty young having that facelift, and it's held up really well. And so she is very active, and to look at her, you wouldn't think she was 70. She's really dynamic, but she's just starting to feel that things are slipping a little. Yeah. And I think a really nice, elegant, conservative aspiration would be just to rewind the clock 5 to 10 years. Yeah. Not try to go back to 50 again, because it's not going to suit the way she moves, the way she carries herself, the rest of her personality. So just a refresh that looks natural, not nothing that's going to scare her or scare her friends, nothing that's going to make people stop and turn in the cafe like, what is going on here?
It's a bit incongruous, isn't it? Because some things can be so tight, and then the rest of your body, like you say, the way you move,
how you get out of a chair,
all of it,
you don't look like you're 50.
It sort of doesn't match. There's a bit of a disconnect.
So I think the finessing and that really kind of natural, and people are left wondering, I wonder if she
had anything done. I guess
that's great.
Yeah.
I wonder if she has. That's beautiful work.
Yeah.
Not the whoa.
I guess that would be probably the ultimate business card if people are not sure.
That's right. That's the highest compliment that anyone can pay me.
Yeah.
Yeah.
Well, there you go. An unsaid business card, isn't it? Have you had something done? I'm not sure. She looks really good, but maybe she's just had a good sleep or something.
Hushed tones in
she's been
parlours.
exercising. Yeah,
perfect.
Behind. Yeah. Okay. Yeah. All right.
He's my guy. Don't tell anyone.
Yeah, I know. Has she had anything done? I'd love to know. You know? Yeah.
That's
as opposed to the overly done where it's just too frightening.
And if that's your thing and that's really what you're aspiring to, I'll send you to see someone else.
Yeah.
Or send you to the Australian Society of Plastic Surgeons and you can do that research for yourself.
Yeah.
Yeah. For me, there's red flags that I say I can't do anything for you ever.
Yeah.
And then there are some like amber flags where we can probably work together, but we've just got to work through a little process first. So a good example is age. So there are some very young girls with huge breasts that are socially, emotionally really constricting, debilitating, as well as being heavy and painful, and the neck pain and back pain and the shoulder pain and rashes, and they're struggling with EFG cups, and they've just gone through puberty, and they just, they're emotionally detached. They wear these big sweaters that conceal their breasts. They hunch their shoulders forward to kind of conceal their size, and they're absolutely miserable. So they can be really good candidates for breast reduction, but it's not the same sort of process that you'd go through with someone who is 25 or 40, because there are consequences of any surgery and potential problems that we've already kind of touched upon earlier that maybe you process differently when you're 16 than when you've had children and breastfed, or when
so you have all these
consequences, the scarring, the potential loss of sensation, wound healing problems. So I usually refer those young patients to psychologists, and I work with a psychologist to just help the patient understand over a period of months, usually a year or even 18 months, this is what you're proposing, this is what can happen. And then once I feel that patient's on board, family's on board, the psychologist says, yeah, everything's good here.
So it's a physical journey, but it's also, I guess, because you've seen it before, it's a chronological journey too, because you can see how the body will wear out, or the life will happen, and things will change. So I guess, that's another thing.
That's right.
The patient's sort of going into it expecting one thing, and you can see how life events will happen too. So you have to factor that in as well.
Correct. And how do you know that at 16?
Yeah.
You've got kind of a finite experience of a lived life. Whereas at
this is a lot, isn't it? There's so much. Like, you think you sort of know and you read everything online, but actually the decision making, there's so much.
There is.
For you to consider as well as the client.
Another good example is a patient requesting abdominoplasty or body contouring surgery, like a body lift, when they're still carrying a little bit too much weight. So they're in a pretty vulnerable situation. They've worked up to this point, they've dieted, they've exercised, they have lost some weight, and they just want to take the next step, and they've spoken to friends and they've read about it on the internet, and let's do this, James. And having assessed them, I'll say, well, we can do it, but if you really want the best possible result, we've got to talk about losing a little bit more weight first.
Yeah, that's a really fine line, isn't it, to try and not hurt anybody's feeling, but also get them ready for a really good outcome, I guess, because this is, from the little bits that I know, like it can be potentially quite dangerous as well, this procedure, if it's not done carefully.
Yeah, absolutely. The dangers are usually manageable, but I'm sort of projecting to an outcome that I want the patient to be delighted with, and that I'll be ultimately satisfied that I've been able to produce for them. And if you're carrying a little bit too much internal abdominal fat, you'll still have a sort of a roundish profile.
Yeah.
So, you know, it's sort of a discussion you have around how we could optimize that weight. And look, if you've said, I've lost 40 kilograms, I've plateaued, I've done it all, and this is it, well, so long as they understand that it's not going to be sort of that ultra-tapered abdominal profile that we can achieve, if they're happy to proceed, we'll ultimately go ahead with that. But that's something you work up to over several conversations. If they are open to trying to lose more weight, well, we engage nutritionists, dietitians. There are all those wonderful new medications available like Ozempic that can assist with losing that little bit of extra weight, 5 or 10 kilograms. And then there are surgical options too, the bariatric operations, if you're really trying to lose a lot of extra weight. Because the surgery that I'll ultimately perform for them is better thought of as a skin reduction operation than a fat reduction operation. Mm-hmm. So if the fat's still there in some way, shape or form, you'll still have a sort of a rounded profile, and you mightn't have that little skin overhang, but we could probably make it a little bit better.
So you have to manage the expectation, I guess, as well. So that really, that starts from way before the surgery, doesn't it?
Correct.
Like a lead up of diet and exercise, like from probably, a couple of months before, would it be? Or?
It can be a couple of years.
Wow, okay.
Yeah.
So it's really,
a couple
really
of patients
considered.
recently have had amazing results using Ozempic.
Yeah.
And they came in with the same story. I've plateaued, I've lost my 3 kilograms, this is it, let's go. And I've said, you know, we've had this chat and educated them about it's not going to be as good as it could be. Do you think you could put a break on rushing to the operating theatre and let's try the next thing? And then a letter written to the GP to encourage trialling the medication. I see them again 3 to 6 months later, they've lost another 5 kilograms.
Yeah.
And they're delighted. And now they're really on the train to try and lose another 5.
Yeah.
Because if they can, when they come to surgery, they're going to have a much better result. They'll also have an easier recovery, and the final outcome they'll be delighted with rather than, a bit happy with.
Well, it's quite surprising, all of this, because, I mean, you sort of feel like you know a lot about surgery, but the more I speak to you, the more I'm learning about all the elements that there are to your job. Like, the surgeon's obviously the most obvious part, but then there's the psychology of it, looking at a client when they come in, what you're assessing them and what you think they need, and is there an emotional issue behind their decision making, and then also the diet aspect of it and exercise. It's kind of like a one-stop shop. Do you know what I mean? Like, you have all these different jobs that you have to do and manage a physical, emotional, outcome as well. It's quite a lot. So the more I speak to you, the more it becomes obvious that the right choice is really crucially important. Really, like it never occurred to me as much as this.
Yeah,
so it's a big job that you've got.
Yeah.
In case you didn't know.
No, I do feel the burden.
Yeah.
But I think you from the minute I open the door to my consulting room, I can see into the waiting room. You instantly reading stuff about the patient, how they're sitting, whether they're interacting with the person they've come with, whether they're disconnected, whether they're sitting straight and tall and scanning the room and look engaged, whether they're withdrawn and look a little bit like they're introverted and unhappy with the world. You see how they stand up out of the chair to walk into the room. Did they get up easily? Are they walking with a limp? Are they stiff? How do they carry themselves? Do they meet your eye when they introduce themselves? Do they want to shake your hand? Are they worried about COVID? Are they wearing a mask? All of these little things.
Yes.
They're carrying a bag. What's in the bag? Is it a big bag? Is it a little bag? The phone going off during the consultation.
Wow, this is a lot, isn't it?
And you're just taking it all in subliminally.
Yeah.
But it all goes into piecing together that patchwork that makes up that individual. And I only get to meet them for half an hour, maybe an hour consult, depending on what we're talking about. And we can repeat that as many times as we need to before the surgery. But you're only getting these little snapshots into their life. So you've really got to pick out as much information. You're sort of trying to
glean the information, I guess.
As much as you can, verbally, non-verbally, the whole bit. If you need to, and they've given you permission, you talk to next of kin, you talk to family, you talk to friends, you talk to the GP, people who've known them for years.
So can you see quite obviously when someone's walking in and they're sort of one thing, and then post-operatively when you're meeting them at, I don't know, 8 weeks, 12 weeks or 6 months, and you see the difference? Does that give you like a thrill? Do you feel like they're showing it, that they feel like a different person, or they look like a different person?
Yeah, absolutely. Absolutely.
Wow. Okay. I'm just going to segue slightly. What is the strangest request you've ever had? Have you had one where you can't laugh but you want to? Someone has said, I'd really love to look like this person, or I'd love this done to me. Do you get strange ones like that, or is it mostly sort of serious stuff?
Thankfully, in my practice, I don't have too many such requests. I've heard it said that a doctor deserves the patients they get.
Okay.
So I'm happy that I've got really sane, lovely patients.
Okay.
But I was asked once for elf ears.
Like Lord of the Rings kind of ones?
It
like
was
a
in
little
little peaky, pointy top on the ear.
So how do you recover when someone says something like that? I mean, do you burst out laughing, or you have to keep a poker face, or are you like, sorry, did I get that? What do you say?
I said, look, you'd be the first patient I'd ever have done that for. And I don't think that's done for many patients anywhere, but with no experience, I'm not the person for you.
Oh my gosh. Yeah.
Straight
Wow.
face.
Yeah.
Straight face.
I don't think I could do that. I would burst out laughing.
Galadriel ears, please.
Oh my gosh. Wow. We can't even blame any, reality star for that one, can we? Because I don't think anyone's got them.
No.
Jeez.
Yeah.
Well, that's a bit of fun, though. That breaks up the day, doesn't it?
It does break up the day. I never know what's coming through the door.
I guess, is that a good part of it as well? You kind
Totally.
of, it's like no 2 days are the same. My mind has been blown today, honestly. There's so much to unpack.
Yeah.
But now I have a lot to talk about at dinner because, when I'm out with my girlfriends, we'll be like, there's a lot. So, yeah thank you.
Absolute pleasure.
You've blown my mind today. It's been amazing. I've learned really quite a lot. So thank you.
Thank you so much, Mel. You've been the best guest. So thank you for coming in.
Thank you.
And thank you for being a part of Patient Matters.
Thank you. Thanks a lot. Thanks for having me.
Absolute pleasure.
Beautiful.
If anyone else would like to be a guest on the show, please reach out to me through the website. That's drjsk or drjsk.com.au. You can also submit any questions you may have through the same website. So once again, thank you for tuning into the show. I look forward to seeing you next time on Patient Matters. This episode was researched, produced and directed by Michael Hennessy. Filming, recording and post-production by Wombat. Photography and lighting by Francisca Rauenhoff. Hair and makeup by JJ Rauenhoff. If you are thinking about undergoing plastic surgery, please make sure to consult with a qualified plastic surgeon. You can listen to more Patient Matter episodes on YouTube or follow the links on the Dr JSK website. Thank you again for tuning in. I'm your host, Dr. James Southwell Keeley.